Welcome, everyone. I'm very excited to be the moderator. My name is Addison Elbert, and I'm going to be the moderator for this panel about different healthcare opportunities. And this is a great variety of opportunity in healthcare. You all come from multiple different backgrounds. So why not get started? And we'll start with Holly. If you could just explain your name, your position, and a little summary of what you do.
Thanks, Addison. I'm excited to be here with healthcare colleagues. Again, my name is Holly Lorenz. I am a nurse by background. I've been a nurse for 40 years, and my current role is Chief Nurse Executive at UPMC for over 40 hospitals and 20,000 nurses. So I can tell you almost 20,000 different types of nursing to move into. I have been in nurse leadership roles for 30 years. And I'm happy to talk about what it takes to become a nurse and the many different types of nursing that there are today. I think all of us here today can tell a story of variety, longevity, adventure, security, and progressive careers. So I think that's unique to healthcare, particularly right now, more than any other field. So really happy to be here with your other colleagues.
Great. And Rachel, if you just want to take it after that.
Absolutely. Wonderful. Thank you so much. Again, my name is Rachael Marcano. Thank you for having me today. I am a senior recruiter with Allegheny Health Network and Highmark Health. I've spent about 10 years or so in the staffing and recruiting for healthcare from a variety of settings, from home health to long-term care, skilled care, correctional medicine, and then of course with Allegheny Health Network. So I'm very excited to be here today and to have some really good conversations with my colleagues, and ready to get started soon.
Oh, sorry about that, Addison. I can go now.
No, you're good. I was going to introduce you, but I figured go ahead.
Okay. Hi, everybody. My name is Michael Audey-Koch. I am the Vice President of Corporate Projects at Passavant Memorial Homes Family of Services. And our organization our mission is to empower individuals with intellectual disabilities, autism, and behavioral health needs. So we have a rich history in the community. We've been around since 1895. And we provide a lot of supports to individuals within their own home or within homes that we operate as well. So we have a lot of direct support. So direct support professionals, therapeutic staff support. We do a lot of hiring in those areas. And we really look for a lot of people that have the passion and the energy and the drive to really succeed in the healthcare organizations.
Thank you. And just a little housekeeping note, we can always, like I said, take this out. If you are not speaking, muting may be the best just for a panel view. And let's take it from there. You all just talked about very different careers, but yet you are all under this umbrella of healthcare. So let's talk about the different career opportunities, more specific to where you're coming from. And Mike, if you don't mind, I'm going to throw it right back to you.
Great. So like I said, opportunities within our organization, we're primarily hiring for direct support professionals and therapeutic staff support. So those positions are really working within our homes to help our individuals with their activities of daily living. So that could be transportation to community events, that's meal preparation, medication administration, really anything that the individuals need to enrich their lives, but also support them in order to be more successful, be more independent, and have that choice and independence within their lives. So our staff are vital to the individual. You create a great relationship with them. You really work with them on a daily basis to ensure that not only are they receiving all of the support that they need, but they're thriving and they're able to meet any goals that they set for themselves and just really enrich their lives on a day-to-day basis. Our staff create long-term relationships with the individuals that we support, and they're really able to make a huge difference in their lives. So that's the big primary hiring that we do. With our direct support professional positions, there really are low requirements in terms of what you need to come on, qualifications. You really need a driver's license and to be 18 years of age or older. Really from there, there's a couple other kind of job requirements that you need to be able to do, but otherwise we bring you in, we give you comprehensive training to be successful in your career and really support you throughout that process. So those are two of the main opportunities. We are also hiring for nurses, managers. We have a pharmacy as well. We have a dental clinic. So we really have a lot of different avenues that we can bring folks in from the healthcare field and really allow them to excel and sort of find their niche and their home within our organization.
So what I'm hearing is, and we're going to pass it on to the opposite of what I'm saying, but you don't necessarily need to be a doctor to be in healthcare or deal with medicine at all to be in healthcare. But before we go and dive deeper into that, some people who may deal with medicine are some nurses. And so I know, Holly, that you had mentioned nursing, and what other career opportunities are there where you are coming from?
Yeah, I'm happy to talk about that. You know, one of the things that's great about healthcare, it can be your first job. You can come with an assortment of skills, or you're trying to figure out what your skills are. And, you know, we have easy to entry jobs if you're really looking for your first type of employment, whether it is a medical assistant or a nursing assistant that's more hospital-based, or there's career ladders that as you gain confidence in really feeling comfortable within the healthcare environment and working with other healthcare providers and healthcare givers and patients, you know, really advancing your career. We have monitor transporters that actually can read a heart monitor and move patients around the hospital, or those that choose not to read our heart monitor. There's people who draw blood, phlebotomists. We actually have, you know, respiratory techs and respiratory therapists. There's physical therapists and occupational therapists. There's so many easy to entry jobs. Our environmental services departments, such as housekeepers, whether they work in inpatient rooms or actually they have, you know, responsibility as other parts of the hospital. Dietary, people who are really interested in either the prepping of food or the delivery of food, or, you know, helping patients eat that aren't independent in eating. So there is this entry into healthcare that is, you know, someone might want to check to see that if they want to do something that's closer to patient care. And it's a great entry for people who might want to be a nurse. When I think of nursing, you know, it's really traditional. And we think of hospital nursing, you know, in a unit, in an emergency room, or in an operating room. But we have opportunities for home health where you actually go into patients' homes as nurses or care attendants, working in senior living and senior community settings, physician private practices, working with palliative care, or even in our insurance departments, school nurses, believe it or not. We actually have nurses as teachers, nurses as leaders, or nurses that are really specialized. So, you know, it's a wonderful opportunity where you're hired once, but you can switch your career again and again and again as you find things that you want to explore or find things that you really love. And so it is really a lifelong career. And it's one of the things that I say very easily, if you're not sure what you want to do, you should absolutely look in healthcare. The security to work in healthcare and also the different paths are just tremendous.
Thank you. I like the word security. I mean, people always, you know, health is a thing all the time, constantly. And let's make our transition over to Rachael. You know, the other perspective, what opportunities do you know? Because you work directly with giving people opportunities, correct? Yeah.
Absolutely. And Holly took all the words out of my mouth. So here we are. It's okay. But no, really just to echo exactly what Holly said, there are a variety of opportunities. You know, there's something for everyone. It's kind of the way that I look at it, right? The career options, they're abundant. They range from exactly what she was speaking of. If you want to work direct patient care, you have those nursing assistants, those patient care techs, medical assistants. But there's a everyone is very important in the hospital setting as far as the environmental services, your janitorial, your housekeeping services. So everyone is a very integral piece, and everyone's really a kind of a key player in delivering quality care to every single patient that walks through the door. And so to kind of piggyback off of what you just said, Addison, as far as me being the person that really brings in the talent, at Highmark Health and at Allegheny Health Network, all of us recruiters are certified career coaches. So we are really able to work through with any and everyone. You don't have to come to us knowing exactly what you want to do. And that's exactly what Holly's talking about. There's so many opportunities. You don't have to know what that is yet. Lean on us to help get you there. Talk to us about your interests. What are you maybe thinking about looking to do? What attributes can you bring? What does your background look like? And where do you want to be in 5 or 10 years? And from there, we can really sort of help you get there so that you're not just taking a stab in the dark to figure, I think I should do this. Let's have that conversation and figure out what best suits what you're looking for and how do we get you there?
And Rachel, to add to that, you can pick, if you want to work with teams, if that's more important to you, you can pick how close you really want to interact with patients, and doesn't necessarily obviously have to be a nursing role. Are you the person who just is coming into a role that you have compassion, or you really have a sense of giving back? Versus someone who's really there to make a difference in, keeping a hospital clean. Today there is just so many different ways to have an impact and add purpose. And I think, Mike, you said the same thing in some of your very specific roles as well.
I love that takeaway. I want to continue on this path of opportunity, and I'm going to throw it right back to you, Rachel, because of the question I'm about to ask, which is, say someone comes in and they don't quite know what they want to do, or they know exactly what they want to do. How would you go about giving someone advice who wants to enter healthcare?
Oops, sorry. Absolutely. So it's a great question. And I think, again, it really goes back to, if we kind of think about what's going on in the last 2 years of the world right now, there's probably a lot of reservations for individuals that think about going into healthcare just because of what we've all experienced. So despite all those challenges, I think one of the really important things is to look at how rewarding a career in healthcare is. And again, both to what Mike and Holly have talked about, whether you're directly patient facing, whether you're doing direct patient care, or you're just a part of that team, think about you're touching that patient's care no matter what you do. And so I think the biggest piece of advice for someone that's looking to join the industry is to look at how rewarding it can truly be, and that it doesn't have to be patient facing forever if that's not what you want to do. There's a lot of ways to be successful in the healthcare industry and still be incredibly impactful. Exactly to what Holly was saying earlier, this is a hot job. Healthcare is, right? It is always going to be in demand. There are always going to be opportunities. It's certainly going to be at the forefront. So keep an open mind about just knowing that you don't have to be a nurse. You don't have to truly be at the bedside taking care of someone, and that there's a variety of opportunity there, and really just thinking about how impactful any and every single person is that's in that cog of healthcare.
I think it is very applicable for any type of role that you might be considering, whether it's within Mike's organization or Rachel's or mine. As we move more into a different time frame of being able to navigate through COVID or whatever it might be at that moment in time, if you're uncertain, there's so many opportunities to come and shadow. Look and see what it feels like, and maybe not just shadow one role if you're really uncertain, but really, walk side by side with a role that you've considered and see what that feels and looks like to you. What happens in that day, and what's the interactions that an individual has, and what are the challenges they face, or how do they, what's joyfulness look like from their eyes in some of these roles.
Yeah, and I would also echo, I think, what you both have said, but reaching out to your recruiter, getting perspective on that. There's a lot to really understand from the organization. What I love with our organization, with having, minimal requirements for some of our positions is we can bring in anyone from any walk of life. And that's what I think is really exciting. It's a challenge for people to really understand, all of the roles that are required of you within the position, but it's a great way just to kind of get your foot in, have those conversations with somebody who you may even know that works. When we talk healthcare, like we said, okay, specific nursing, yeah, that's a main forefront, but there's, like you guys have said, there's so many other parts of healthcare that I can guarantee you know people working in the industry in one way or another. So really just reaching out to your networks, understanding, what the positions entail and finding what interests you the most. I mean, we have a lot of folks from other industries, so it's really, and what my team in terms of recruitment really takes time to do is explain the job in honest terms so that you come in with an understanding of what you're going to be doing and you don't come in thinking, one way or the other. With our jobs, you are supporting and you are taking care of individuals, but there's so much growth and so much fulfillment within that is truly what we look for in people, is that passion and that energy to want to give back and want to make a difference.
And, one of the things that I think is really interesting is what you bring from an education perspective. There's obviously roles that don't require a high school education. There are roles that require a high school education or a GED, and there's some that can require some VOTEC experience, or those that require a community college, or those that also require a graduate degree with a bachelor's from a university or an organization. So don't feel that you don't have what it takes, because there's so many different roles that, as you've heard from Rachel and Mike, we can fit the role to the individual that comes to the table. And that's the beauty, I think, of healthcare, because there is so many opportunities.
I hope that gives, that statement gives someone the confidence. I think even me, I'm a communications person, but I was like, hey, maybe I could have a role in healthcare. And like Mike said, I probably would find a role.
There's 3 folks here. If you want a career change, let us know.
I moderate the panel. I switch a career. That means you guys are good at what you're doing, right? But speaking of having recruiters on the call, and you said get in contact with your recruiter. How would I even go about that? Say I'm in high school. I know I don't want to go to secondary education. I don't want to go to college. I don't know if I want to do VOTEC. How do I get in contact with someone? Anyone?
I'll take it up front. You can look at our career page, pmhfos.org/careers. We have a variety of ways. You can text to apply. You can reach out to us via email, any way possible. As long as you're interested, we have a lot of avenues to reach out to you. We have a phone line as well that you can call, and a member of our team will return your call and talk through the process. It's what we like to do is generally just allow folks who, again, don't have that experience to just have that conversation without having to take the step forward to apply. So our team is always available and always ready to kind of reach out with any questions and concerns and really talk through, what our fulfilling careers are. We love to talk about it. As all of you can attest to within your careers, happy to talk at end about all of the positions and all of the opportunities we have.
And I think to piggyback off of that, Mike, as well, something that Allegheny Health Network and Highmark Health does, we go to the students, right? When they're still in school, to that very point, we really want to start this from day one. So to your very point, Addison, they don't know, where do I go? How do I start this? So oftentimes we will work with students, even in high school, certainly in colleges, and doing career fairs and mock interviews and all of these activities to really not only introduce healthcare as an option to these students, but also giving them life skills. So whether that be with us specifically as they come to interview or wherever that may take them, those are still vital skills that we know that we can pass on to them. So to that point, I think it's really about kind of capturing them early and showing them, here's some opportunities for you. Here's what you can do. Let us help you do that. And here are some other tools and some skills that you can utilize, whether it's for this opportunity or for future ones. Something that we have within Allegheny Health Network, and it is specific to nursing, and that's the hat I typically wear as far as the population I work with, is nursing career coaches, where we are working from day one with these nurses when they're entering, whether that be the diploma program or their associates or even their 4-year degree. And you have a dedicated career coach that really kind of holds your hand through the entire process and figures out, where do you want to go as a nurse? Where should you start? What type of unit maybe do you want to work on if you want to be in an acute care hospital setting? What makes the most sense as far as your future? And it really gives that student kind of a boost of confidence in knowing that they have someone that has their back and someone that can really hold their hand and walk them through, not only once they start with us, but beyond that, and that they always have a go-to, a contact. I remember you, Sally, from 5 years ago or 10 years ago when I was in school. So, again, it's all about really starting early and really getting those connections built from day one and making those students and making others just feel comfortable and knowing that they have some resources to reach out to.
One of the areas we didn't mention, and as you think of starting early in the schools, guidance counselors, if you are someone in school, obviously, websites are really easy to search through as well. It is really unusual to even reach a single contact in a healthcare setting where they don't know who the recruiter or who the talent coach would be. I think that, it is, if you're uncertain, I would just suggest that you check in with someone, whether that's someone who's in healthcare, whether that's someone that that has a contact in healthcare. I think there isn't a week that goes by that I'm not out in the community that people who know I'm a nurse say, hey, I have someone that wants to work in healthcare. Can you help me? And all three of us, we're sitting here shaking our head. We do that iteratively all day long. So, it is just about asking someone. And we live in such a small community for healthcare that there is someone who can connect you as well if you don't know which way to turn.
I think it's funny. The feeling that I was getting is like, wow, this is so welcoming. There, everyone's accepted, everyone's welcome. And I said, oh, it's healthcare. I was like, it's funny to think that, they're thinking about the health of people and they're wanting other people to help other people. So just a little fun fact. But something I did pick up on, Mike, you said you can even text in an application or reach out. And I thought to myself, man, texting. So my next question is, how has your position or healthcare in general evolved over these past 5 years? I'm sure 5 years ago, I'm not sure if you could have even done that or gotten in contact with someone that quickly or that easily. So I will actually throw it to, I'll throw it to you, Mike, because I just mentioned your name. I think I threw it to you first last time too. So sorry to put you on the spot, but how has it evolved?
I think our organization in general, even through COVID especially, has evolved to implement more technology across the board. We have a variety of tools specifically for patient care and the care of our individuals, where we implemented like daily monitoring of temperatures. Well, we created a whole suite of tools actually with our information technology team to log that from each time that is taken so that we could track and trend that. And if there were any changes to that individual over that period of time that we were measuring, it would flag to our nursing team and they would follow up directly with the home and directly with the individual to intervene and ensure that appropriate care is taken based off of the symptoms that are showing. So we do that across the board. Our organization, while we have a rich, long history, we are also very dedicated to innovation. So specifically with recruitment, we have implemented a variety of tools to help ensure that candidates can reach us from texting. So you can reach our team. We have a platform that our whole team manages to ensure that there's communication back and forth throughout the process if you have any questions. We allow candidates to self-schedule their interviews for our positions. They're able to log on and it's a little less intimidating. You're not working with somebody directly. You can go on, pick the time that works for you, reschedule your interview whenever you need to if there's something that comes up. We allow that kind of flexibility. So I think in terms of just changes holistically, and I think everybody can kind of speak to this, technology is just infusing its way into everything that we do because of how much it can streamline what you do and how you do it. And it's really just changed our organization. We've come together, especially through COVID, just to create just a variety of tools to be able to communicate and escalate anything within the organization to ensure that we're taking appropriate action. So I think overall technology is where I would say the change is occurring, and it will continue to occur for a very long time.
And I can imagine that is across the board, technology. And can someone answer, do you think is that a good thing? Have you seen it be a positive thing? I mean, also it could be a negative thing, but I wonder, I'm very curious. I know there probably, there's both sides, but.
So being probably the oldest person here, even I say technology has been a good thing. I'm certainly maybe a slow adapter. I think it has made in healthcare a safer environment because information is real time now. And I would say it has increased the speed of communication, which allows people to take care of patients more timely. I also think that it's allowed nurses or any health caregiver to actually be more productive in their day. So technology has really been a good workflow enhancer to people as well. So, technology has certainly been one of the changes that's out there, and I would certainly call it a positive change. But there's been other changes as well, but it certainly, even from the recruiting standpoint, has been very, very dramatic. Texting is a very common way to communicate between managers and their employees, with cascading communication happening almost instantly. So there's just so many different ways that I believe it's really enhanced and allowed people to work more fully to the top of their roles.
And Rachel, I don't want to leave you. I throw the question around, but you can answer either one.
No, absolutely. As far as kind of taking it to a network-wide growth, right? And your question about how has our position, maybe our company, changed in the past 5 years. I think what's really vital for individuals that step into healthcare, back to what Mike has said before and Holly, about being very passionate and really wanting to be impactful. For me, especially as a recruiter, when I'm able to talk about what our network has done and the strides that we've made and the growth that we've experienced over the last few years, it gets me excited. And in turn, it gets our candidates excited and it makes them want to be there. So I think truly, despite the challenges that healthcare in general has faced over the last few years, I think that AHN has continued to have great success and growth across our region. Highmark and AHN, we've really set out to ensure that our members have care very close to home, right? And that they don't have to drive to the city necessarily to have that top-notch care. So from investing in our community, such as having these neighborhood hospitals that we've opened, cancer centers that are freestanding so that you're not having to be admitted to an inpatient unit in order to get your care, right? And we just opened Wexford Hospital to really serve the North Hills community of Pittsburgh. So those are just some things that we have recently done. We've got some future endeavors as well, as far as opening several outpatient hubs, partnering with different organizations, Steam Fitters Union, partnering with preferred primary care physicians. And so we really, again, want to expand that care close to home and have a lot of opportunities for our members. And in turn, that's going to create a lot of jobs as well. That's what we're here to talk about, right? Is healthcare and what those opportunities are. So I think for us as an organization, what has really changed over the last 5 years is positive. It's a lot of growth, and it's really about getting back to the heart of taking care of our community here in the Pittsburgh area and providing a lot of quality care right around the corner in your community, where your caregivers are the same individuals that you're seeing down the street at the grocery store, or you might be seeing at church on Sunday, or you may see them at the mall. And I think that's really important to really have that close connection, that close tie to your community. So a lot of growth and really trying to serve our population here.
You
And
said,
I
go ahead.
think the past 2 years have really increased the speed of access and adoption of some of what Rachel described, the role of telehealth or virtual visits, allowing experts that may be very centrally located in a highly demographic area, having access to people that live in rural areas. It's another way that technology has really empowered the community to have the same type of care no matter where they live. And so, even in the jobs that I think of, the number of technology jobs that exist in healthcare are tremendously increasing, whether it's a physician on telehealth or an informatics nurse who's managing some of the, networking to make that happen. So again, another area that's just really rapidly expanded, to navigate through times when people didn't want to come into a hospital. And that's, that's allowing us to provide actually earlier care, preventive care as a result of technology.
Well, you hit the nail right on the head with where I was going next after Rachel said the word challenge. I'm sure the elephant in the room when we say healthcare, people think COVID-19. So I'm sure that was a challenge in itself in working in healthcare, as it was in many different fields. And you can touch on that or another challenge that you have seen in the healthcare field. If anyone wants to take it from there, go ahead, just challenges.
Yeah, I'd love to jump in with that. And I think every last person on this call can agree, at least staffing, right? I think, but that's something that is nationwide, and it's not even necessarily COVID related. Yes, we have felt that burn over the last 2 years, but this goes back to years before that. We saw this coming, right? Baby boomers have long made up the majority of the healthcare workforce, and so particularly nursing. And so as we're starting to see them retire, it's playing that catch-up game and really being able to fill those shoes of those individuals that are leaving the profession. I think also what we're seeing now is that a lot of folks are going to do travel opportunities, travel nursing, but it's not just nursing. There are other opportunities for travel contracts. 3-4 years ago, that wasn't very common for clinical positions to have travel jobs, but now you're seeing it everywhere, whether it's nursing, radiology, surgical techs, respiratory, and those travel contracts are very lucrative. So that's another large challenge, is truly how do we, the folks that are here at home, how do you compete? How do you keep up with that when there's a lot of opportunity I can go to sunny California and make buku bucks, and well, how do I keep those folks here? Because that's a challenge in and of itself. So staffing, that's my answer.
So I can add to that, I could talk about this in my sleep, as I'm sure Rachel could as well. So obviously we've been focused hugely on recruitment and retention. And what also follows with that is how you become more adaptable and how you respond to these changes so quickly. And I can think of probably 2 things that speak to this that were areas that we knew we needed to pivot on and do really, really quickly. And the first was actually flexibility. Healthcare is not known for flexibility in work schedules, but we heard it everywhere. We heard it from different generations. There were, some of our more senior staff that were taking care of patients, family members, parents that were ill. There were some of our younger employees that had homeschooling or needed to be the school bus or needed to be the Meals on Wheels for their family. And so we quickly decided that we needed to be a flexible organization and allow people to work the hours that they were available, not the hours that had been traditional for us. And when you think of traditions in healthcare, they go back hundreds of years. And so being able to respond what the employees wanted from a work-life schedule. And with that, one of the other pivots we did that speaks exactly to Rachel, we knew that everyone wants something different out of their job. Travel was an example of that. So in 90 days, we stood up our own internal travel agency to allow people who felt that that was a flexible work life that they had, where they didn't have to be in their own bed every night sleeping. They could be traveling within our own company across our 3 states. So how you adapt when there's change and be able to pivot to provide what you, if you listen to your employees, you can hear what they want and need, and then building that program. So there's this portfolio of different selections and programs for people.
Yeah, Rachel, I would 100% agree. Staffing has been one of our largest challenges. But what I think that's sort of unique, and maybe not unique, but something that we can offer within the healthcare field is because we are 24-hour operations, we do have a variety of shifts. We have a variety of different ways that you can work to meet your schedule needs, your family's schedule needs, whatever you need. I mean, we have shifts down to a point, we call them block shifts. So you're basically at the residential service location, it's a 2.5 day working shift. So you work 1 day, you stay over, you're off the clock then, but then you come back on for the next day, you stay over, and then you work another half day. So 2.5 days, you're getting your full 40 hours of work. And you only have to drive, gas prices as they are now, drive once to work and once home. So there's things like that, and I'm sure you guys have all of those sort of variety of schedules that really help connect. And I think that's one of the cool challenges, but also one of the nice parts about working in recruitment is being able to connect with a candidate on that sort of level to say, what does your schedule look like? Okay, it's not 9 to 5, Monday through Friday, but what could we do to work with you and your family's needs to make sure that you can be home, take care of your family, but also, do that full-time job and make sure that you're balancing all of those life responsibilities. So there's a slew of different shifts, of different options to be able to meet your needs across the board. So that's something I really enjoy. It's a challenge. Staffing is always going to be a challenge for us with direct support professionals. They call it the DSP crisis in terms of just the need for direct care staff. And that need is only going to continue to grow. We're not going to see that slow at any point in time. So we're all working diligently to ensure that we can continue to bring in qualified, passionate, and caring folks into the organization. So I think that's really, it's the challenge, but it's also the unique opportunity that we all get to have to provide those connections.
I think without knowing it, you all just addressed those misconceptions that may be associated with healthcare. And I think that the words flexibility, security, we hear job security, and amongst others, a variety, all of those, a lot of people maybe didn't think of at first whenever they thought of healthcare. So just in the middle of the panel, high five of there's those misconceptions, let's put them down. And something I want to talk about, which I think it was Rachel, I think you brought it up, you said, let's stay here. When I grew up, I am a Pittsburgher. I'm a native Pittsburgher, but I think healthcare, I think Pittsburgh. We have so many different hospitals, so many different opportunities. So can someone speak to Pittsburgh and why being in healthcare and being in Pittsburgh may be a very good move to make?
I'll chime in. I think very much to your point, Addison, there are so many opportunities, but let's take it back to education, right? Especially, again, my brain goes to nursing, but it doesn't have to. But in that particular vein, there's so many schools of nursing, whether you want to do a diploma, an associate's, a 4-year degree, and beyond and beyond and beyond. There are so many opportunities in a relatively small city. It's a good enough size metropolitan city, but we're not talking this huge honking, Los Angeles or New York City or something. So to have so many opportunities to get that education to step into healthcare, if truly the type of role that you're looking for would require that, there's that available to you. Then you also look at the cost of living. It's incredibly affordable to live in Pittsburgh. So I think when you start, you can go into healthcare anywhere. In all 50 states across this country, you can do the same job almost anywhere. So why come to Pittsburgh? Because it's affordable. There's a lot of opportunity to learn here. And there's a lot of opportunity to work here, whether you come to a larger health system like UPMC or Allegheny Health Network. Maybe you want to work outside of the acute care setting and you want to do home care, or you want to do long-term care. Again, there are so many different avenues that you can go. There is not, there's so many different places to be. We're not lacking opportunity, that's for sure. And so that would be my 2 cents as far as healthcare in Pittsburgh, because you can do it. You truly can.
I don't know if anyone had anything to add. I always think of, you mentioned it, it's a relatively small city. 40 minutes that way, there's a farm. Right next to you, there's a suburb. And then in the middle, there's a hustle and bustling city. But Holly, I see that you maybe want to say something too.
I am not from Pittsburgh, but I have moved here twice intentionally. And so to me, it is a very livable city. I know that, when you think of the sports teams and you think of, the culture and the Pittsburgh arts that are here, we have all of the components of a big city. And so I think it's even been ranked the most livable city. It's been the best city for singles. If you look at all of the different accolades that Pittsburgh has, it really highlights the employment opportunities, but also the socialization and the personal lives.
Yeah, Holly, just to piggyback off of that too, I think when you think Western PA, you have it all too. So maybe you don't want to live in the city of Pittsburgh. Maybe you're not into the city living. We have a lot of really great areas, even outside of that, where you can live on the farm if you want to, and be in more remote areas where you may find a more small town feel that meets what you're looking for. So I think the opportunities are across the board, whether you love living down in the city, feeling the culture and the experiences there and the growth of just the city itself. But you can also, if you're comfortable with more of, a small town feel, there are just so many good communities that surround Pittsburgh that are just tight-knit communities where you can make a home for yourself and your family for a long time. So.
I just got on my Pittsburgh train. I drive through the city and I see so many schools. If you want to go to schools, so many hospitals, and all of that can be done right there. The shadowing that you're talking about, the internships, the calling, and the telehealth. I mean, it is truly all here. There's my spiel for Pittsburgh. Everybody wants to go to Pittsburgh, but to move on along with healthcare as well in wherever it may be. I don't ever want to leave anyone feeling like they didn't get to say something, but I also want to touch on some advice, whether it be a middle schooler who is tuning into this panel, whether it be someone who's leaving high school and not sure if they want to do college, whether it be someone who's in their 30s and maybe has a family and they want to start over and they don't know if they can in healthcare. That was a loaded question, but I will throw it to Holly first. What advice would you give to someone watching this who maybe now has the bug of wanting to join healthcare?
I'm going to go back to one of the original things that I said of shadowing and having the opportunity to actually see it in action. I think it will grab your heart, whatever field in healthcare you wanted to. It's there. Healthcare is about a team. It's about relationships. It's about feelings and emotions and people. And I think that you see that really live in action. If you're in, school, getting ready to graduate from high school, tap into your guidance counselors, look at the job fairs that are probably and career fairs that are in your schools. I don't think there's a day I don't see about some type of recruiting event for healthcare that's in Pittsburgh, whether it's virtual or whether it's in person, or find someone that that's doing what you think you want to do and have them help you get connected. Healthcare is about connections, and I would imagine anyone would be able to put you forward in the right direction. Would be my thoughts.
I think, again, to really piggyback off of Holly and what Mike said earlier about, we all know someone in healthcare. Everyone knows everyone in healthcare in some facet, right? So I think it's about just going in with an open mind. That would be my piece of advice. We all have kept saying it over and over, but it just could not be more true that the opportunities truly are so endless. I think that a lot of times folks get so kind of, cited on, I have to be a nurse or there's nothing else, but there's a million other opportunities that are still incredibly impactful and still touching the patient's lives every day. So just have an open mind and know that pretty much no matter what you do, there's an opportunity for you. They are endless. And right to Holly's point about shadowing and just sort of even like our volunteer program. I know, I'm sure UPMC has something, Allegheny Health Network has something. There's a lot of different opportunities like that where you can volunteer so that you still feel like you're very much making a difference, but that you're getting able to see a whole bunch of different things in that hospital setting or within healthcare. So that's one way to shadow, if you will, to Holly's point, and really figure out, does this work for me or does it not? And so I think my advice would be just go in with a very open mind and know that there is really something for everyone. And it's never too late. It's never too late either. It never is. There's a lot of those. I oftentimes, again, back to nursing very quickly, I talk to second degree nurses, right? So they have degrees in other fields. And they decide, one day they wake up and they're in their 40s, maybe, and their kids are grown, and they're like, I'm going to do something for myself. What can I do? And they go back to nursing school. And I love, love, love speaking with those individuals because they're not always the 20-year-old that's, ripe in their nursing class, right? They've come back to do this. And I love talking to those folks because talk about dedication to really kind of dive into this career later on in life is fantastic. Hats off. And so it's never too late. And there's always an abundance of opportunity. Absolutely.
And I would actually say I'm actually somebody who made the transition into healthcare. So I have a previous background in engineering, so very different. And, I loved my job, but I wanted something that made more of a difference. So that's when I sort of looked around to see what else is out there that I can get involved in. So you can see if a person that has an engineering background can work their way into healthcare, anyone can. I mean, it's an organization where, and an industry where passion sort of has to be a little bit at the center of what you do. You have to have some passion for what you do, or else you're not going to be successful, because you really are working with people and you really need to have that passion and energy. So I think for me personally, like figuring out that this is what I wanted to do was really like Holly and Rachel have said, talking to people, getting their real view of what they do and understanding that up front before I made any type of decision. So I think if any students are watching this from middle school to high school, you just really have to take yourself out of your comfort zone a little bit. Look for those volunteer opportunities where you might say, oh, this is like, I'm a little nervous, I'm a little scared to do this. This isn't something I normally do, and just do it. I mean, it's a jump, but once you do it, you're going to find your passion, and either you find it or you find a new passion that you're going to do. So there's never a downside to taking a leap and taking a chance on something. Just trying it out for a little bit can really help you understand where you want to go in your life.
Thank you for sharing. I love that. Engineer turned healthcare. And that's exactly, I think, the misconception that all three of you squashed today, which was healthcare doesn't necessarily mean hospital. It can if you want it to, but it doesn't have to. And it doesn't necessarily mean doctor. It doesn't even mean school, secondary school, if you don't want it to. And again, it can. So I just thank you all so much for giving us a more holistic view of healthcare and showing the variety that it does come with. And also, I must say, because you are all in healthcare, these past few years, as many will say, thank you. I know that it is in every field, the determination, the compassion that you have had throughout difficult times, but really are unsung heroes. There you are. And I appreciate you guys coming on this panel today and giving anyone who's watching a new opportunity and hopefully a head start. And WQED can be that head start too if you want to get in contact with any of these panelists, businesses, companies, shadowing opportunities, recruiting opportunities, WQED can help, or you can reach out directly. This can be the start, it can be the middle, or this could be your end goal career. And you guys all made that possible today. So thanks.